Good morning, everybody. I'm excited to be making this video this morning. It is October 30th, which is World Hypophosphatasia Awareness Day. As many of you might know, if you've been following my Facebook, I have been diagnosed with a rare genetic disorder called hypophosphatasia, or HPP for short. And I was diagnosed a little over a year ago. And I want to share that journey with you and basically explain how that diagnosis came to be. HPP is very rare. It affects about 1 in every 100,000 people. It may actually be more common, though, than we think, due to misdiagnosis and diagnostic delay, because it can often take years, sometimes even decades, before getting an accurate diagnosis. So it is a rare disease. Rare diseases as a whole are not particularly rare. In fact, 1 out of every 10 Americans does have a rare disease. So it's important to share and raise awareness, even if it's not specifically for HPP, but for rare diseases as a whole. So part of the reason why HPP is underdiagnosed or misdiagnosed, or why it takes so long to get a diagnosis, is a lot of the symptoms can be very vague and can be attributed to other disorders. So for me, what happened, I'm going to start at birth basically, or shortly thereafter. I actually have a typewritten note from my pediatrician. I think I was about 2, if I recall, at the time of that letter, which stated that my hips over-rotated. Now, interestingly, when I Google that, nothing really comes up about hips over-rotating, but basically what it meant was that my joints were abnormally mobile, and his solution to that, which makes perfect sense, was to strengthen the muscles around the joints with the idea that the stability of the hip joint would be better. So I was assigned to go to dance and gymnastics at a very young age. And unfortunately, it was a good idea, but it didn't work. And I really didn't like gymnastics or dance, so I was taken out of those programs. Then, of course, one of the early signs of HPP can be problems with dentition. So losing your baby teeth at an early age, or losing them with the roots still intact. Now, of course, I don't really remember how old I was when I started losing my teeth, or if I lost teeth with the roots still attached. I do remember having to go to the dentist often and having teeth extracted often. So it's kind of, I'm not really sure about that, we'll say. But as I got older and I started to approach adolescence, I started to have other symptoms. Migraines, for instance, diffuse all over body pain, joint pain, crippling fatigue. And I was brought to many specialists, to be evaluated for my migraines and for the fatigue. And nothing was really ever discovered. And so my parents and I heard a lot of things like, well, she's a little overweight, she needs to lose weight, or maybe it's anxiety, or maybe it's hormones, or you name it, we heard it, but we didn't get any answers. As I approached my 20s, I started having more significant problems with my connective tissues. So I was developing tendonitis very frequently, excuse me, in my elbows, my wrists, my feet. I was I've always been flat-footed. In fact, my feet pronate, so I walk like on the inside of my foot, and I have to wear special motion control shoes to try to prevent that overpronation of my foot and keep my feet, my legs in better alignment to support my body. So I very rarely walk barefoot and almost always wear my sneakers. So in my 20s, migraines got worse, fatigue got worse. I was having these vague tendonitis issues. But really, again, even with seeing doctors, they really weren't able to tell me what might be going on. Now we fast forward into my 30s. I tore the labrum of my hip, my left hip, doing something which shouldn't have really resulted in that type of an injury. And then I also developed severe pain in my left shoulder. And when I had that x-rayed, it was determined that I had what's called calcific tendonitis. There was calcium buildup in my tendon, which was causing severe pain. I mean, just crippling pain. The hip was treated with a steroid shot. Thank goodness that worked. And ultimately, the shoulder was treated with a nerve ablation, and that worked miracles for me as well. Then in around, I think I was 38 or 39 years old, I was hospitalized for sudden loss of balance and coordination, which I've talked about extensively on my Facebook. I was in the hospital for 3 days. At that time, I was only on 3 medications, and I was evaluated very thoroughly. And really the only thing that was found in this evaluation was degenerative joint disease. My neck was a mess. I had a herniated disc. But really, again, I was sent home with a walker and no answers. And that was very, very frustrating, for sure, you know, because I went from being very, very functional, active in my work, to suddenly having to use a walker to get around and not knowing why that was happening. I'm going to fast forward because it's a huge diagnostic odyssey, and this is very common for people with rare diseases to have to go through something like that. I was ultimately diagnosed with Chiari-1 malformation, which I have spoken about on my Facebook, and with POTS. POTS is a form of dysautonomia. POTS stands for postural orthostatic tachycardia syndrome. And with hypermobile Ehlers-Danlos syndrome, which is a connective tissue disorder, which basically indicates that there's faulty collagen, which creates issues with the joints being overmobile, and ultimately results in pain and deterioration of the joints. There are many other symptoms that are associated with POTS and EDS, Ehlers-Danlos syndrome, Chiari. There's so many things, and they all kind of overlap. But what actually led me to the diagnosis of HPP? That's the most important thing. So for the diagnosis of HPP, once I was diagnosed with dysautonomia, I started researching. I wanted to know everything I could know about what was going on with my body. And I found that dysautonomia sometimes runs hand in hand with autoimmune diseases. So I made an appointment to see a rheumatologist to be worked up for autoimmune diseases, which he was happy to do. Upon examining me, he said, "You have fibromyalgia." And I was like kind of skeptical about that, because fibromyalgia to me is kind of a diagnosis of exclusion, meaning we don't really know what's causing your pain or what's wrong with you, so we're going to say you have fibromyalgia. And there's really not a lot you can do to treat fibromyalgia either. So a bunch of blood work was ordered, got that all done, went back to see the doctor, and he's reviewing my blood work, and he says to me, everything here looks normal, but has your alkaline phosphatase, or ALP, always been this low? And I said, yes, actually it has. I can actually even pull up 5 years of history for my alkaline phosphatase right on my phone through my medical records. And I showed that to him. And I said, I Googled it, and there was this rare disorder called hypophosphatasia. But when I reached out to the organization, Soft Bones International, the doctors that specialized in the disorder don't take my insurance. So I just kind of let it drop. I had enough going on. I was like, what are the chances I could be one of the 1 in 100,000 with this rare genetic disorder? So I didn't pursue it. And he said, well, yesterday, literally yesterday, he had a orientation, an in-service done by a pharmaceutical representative from Alexion, and the talk was about hypophosphatasia and the medication, the enzyme replacement therapy that's currently approved to treat hypophosphatasia. And he said, I hope you don't have it, but I'm willing to work you up for it. And if you do, we might write a paper on you. You'll be a case study for our office. Wow. So I went and I had my vitamin B6 level checked, which is typically elevated in patients with HPP, and mine was elevated. Clinically, my signs and symptoms matched that of HPP. So I was diagnosed with juvenile onset hypophosphatasia and started on enzyme replacement therapy. I've now been on enzyme replacement therapy for a little over a year, and I have noticed some positive changes, and most definitely when I'm not compliant with my shots, if I stop them, I definitely notice a difference. So I'm very grateful to have that diagnosis that takes so long and is so difficult to get for so many people. And then to have some kind of a treatment available to help offset the progressive nature of this metabolic condition, because HPP does not just affect bones and teeth, it can also affect your eyes, your joints, your kidneys, your cognition, your breathing. In fact, some forms of HPP are fatal, for in utero and perinatal HPP. Those forms of HPP are often fatal. So it's really important to, if you do find that you have chronic low alkaline phosphatase, for adults that's anything below 40, to be worked up for this genetic disorder. If not for yourself, for your future family members or children. So that way you're aware of it. And it is often very much an invisible illness. You can't look at me and know that I have hypophosphatasia. So it's important to raise awareness. Doctors are taught when they hear hoofbeats to think horses, not zebras. So what that means is, if there are symptoms pointing to a simple diagnosis, that is most often the cause of those symptoms. It's usually not something super rare like you see on the house, right? On Medical Mysteries on TV. However, zebras do exist. I am most definitely a zebra medically. So the important thing here is share the story, be aware, listen to your body, advocate for yourself. If you feel that something isn't right, don't give up. You know yourself the best, and it's really, really important, and it can often be life-altering, life-changing to have a diagnosis and then to be able to move forward with treatment and other therapies to help alleviate symptoms. It can really be a miracle just to have a label, because it gives you a starting point. It can be really difficult to accept a diagnosis, and of course very challenging emotionally, but it does provide you with validation. to know that there is legitimately something going on in your body, and that something is real, and everything that you're experiencing is valid. With that being said, I hope everybody has a wonderful October 30th, a wonderful World Hypophosphatasia Awareness Day, and thank you for listening to me ramble for 15 minutes. Take care. Bye-bye.